Welcome to #Wednesdays Weekly, a weekly information session in collaboration with the public sector and voluntary sector partners. Today's host is Emma Medhurst from Barnardo's. Over to you, Emma.
Thank you. Just going to get my screen to share. Right, that should be absolutely fine. Hi everyone. I thought I'd start by giving a bit of an overview of what SENDiass is. So SENDiass stands for Special Educational Needs and Information, Special Educational Needs, Disability, Information, Advice and Support Service. Sorry, for some reason it's not, let me just. There we go. Here we are. So this is what we do. We, as part of the Children and Family Act 2014, it's a legal requirement that every local authority ensures that children and young people with SEND and their parents and carers have access to impartial information, support and advice. So we offer impartial support and advice that's confidential to children and families. We sit separately from the local authority, although we are commissioned by them. We don't sort of break confidentiality. We stick to our role. We will share data gathered by us, but we don't give out personal information. So it might be that we give a percentage of parents or children that have contacted us that have needed advice on, say, annual reviews or education and healthcare plans in a quarterly term. So this is where we fit nationally. So as I said before, we're part of the national network. We are funded by the Department for Education that comes through the local authority, and practitioners have to have 3 levels of law training based around special needs and disabilities. As I said before, we're a statutory service. We do feedback to the local authority and the DFE, so we might do that, like I said before, by, oh, do you want to let this person in? Sorry.
She's in. I've let Louise.
Oh, thank you. So we do sort of provide data to the local authority and the Department for Education, but we don't share personal information. We don't discuss any aspect of what we're doing with the local authority unless a parent or young person asks us to on their behalf. So everything is strictly confidential and very impartial. We can't tell people what to do with the law. We are there to advise on the options that people want to follow. So we have legally trained practitioners. We support in matters relating to education, health and social care. Initially, we give advice over the phone. That's usually a first point of contact for our parents or young people. But it could be that we give basic advice on a drop-in session or an online Zoom session, as the way that the world is moving in these circumstances. We do offer face-to-face appointments as well, so it could be that the parent or young person or the child themselves need a little bit more work, or the work that we do to support them requires a face-to-face meeting, so we can offer them as and when we're available. We can help people prepare for meetings. So sometimes parents get a little bit nervous if they're attending a meeting about their child or young person, whether that's in school or with the local authorities, so we can help them prepare for that. Sometimes we can attend with them. So we might attend an annual review for a child that's got an education and healthcare plan. It might mean that a parent would like some support in a general meeting within school to just have somebody there to sort of guide them on the facts that they want to address in the meeting. So we wouldn't necessarily speak for a young person or a parent, but we'd be there to sort of make notes on their behalf and just to draw them on the key points that they wanted to discuss within that meeting. We offer resource packs, so if parents or young people phone in and they are, for instance, inquiring about the level of support, this is something we're touching on later, or education and healthcare plans, transport, anything like that, we've got resource packs that sort of give the legal background of what they've asked for. So it gives basic information, the legal background of it. So they've got that then as a source of reference if they're needing that to go into schools or contact the local authority. We do deliver workshops, as we're doing now, and we give these to parents and young people, and we also deliver them for professionals for a range of topics. We also signpost much of the time to different services. So if we, for instance, get parents or young people that are struggling in a setting, a school or a higher education setting, and they explain that they're also finding other things difficult, it might be that we can signpost a referral to Healthy Young Minds or occupational therapy and other services similar to that. So much of what we cover is along these themes. So we get parents phone up a lot of the time, or young people inquiring about what education and healthcare plans are. Annual reviews, so people with an education healthcare plan have that reviewed every year, which is called an annual review, and there's legal aspects for that as well, and the time frame in which this should take place. We help parents prepare their young people for adulthood, and also work with young people preparing for adulthood, so looking at the changeover of services from children's to adulthood. We deal a lot with exclusions, and a lot of the parents that we have contacting us are very unaware of the exclusion system and what would be a lawful exclusion and what's not so much a lawful exclusion. So we give advice and support around those. We discuss part-time timetables. We can support parents with situations where they might be looking at transport for their child or young person, getting to and from school or college. So I thought the majority of the people that do phone in want information on the sort of support that they should be receiving or their child should be receiving in school or nursery or higher education. So I thought today's session would be a good one to cover SEN support. I'll give a brief explanation and then go into it a little bit further. So this is a session or a workshop that we deliver quite regularly. And like I said, it is one of the ones that we do cover much of the time. Some parents feel that their child or the young person isn't receiving the adequate support they should at school. So we can give them some information around that to sort of ensure that that support is in place moving forward, and looking at the level of support that the young person or the child is receiving to see if we can offer or advise on further support and how that's achievable. So the legislation and guidance covered in today's session on SEN support is under the Children and Family Act 2014. And that's law, that's lawful, and that should be happening. The statutory guidance is the Special Educational Needs Code of Practice, and that was established in January 2015. So just a quick note, it's important to understand that where statutory guidance is useful, it should not be followed. Legislation always supersedes this, but it's important to utilise both of those. So throughout this workshop, I might touch on different bits of statutory guidance and legislation. So the type of support that children receive are there. So every child will receive universal support. Some children might receive special educational needs support. Other children with more complex needs will receive education and healthcare plans, and the support written in those is legally binding. So the universal support is provided by first quality teaching. So that's differentiated work, it's happening in the classroom for every single child. SEN support is slightly different. So these children and young people will still be receiving much of the universal support that's available, but it might mean that they need a little bit of a top up in some areas. So it might be additional, and it might be slightly different from their peers in class. So it might mean that they receive additional support for literacy 4 times a week in a small group. it can be something as basic as that. Some support can be a little bit more complex. Education and healthcare plans for more sort of severe and complex needs. So it might mean that children receive SEN support, and if a child isn't seen to be progressing or their needs are a little bit more in depth than originally thought, then it might mean that school or parents themselves can apply for an education healthcare assessment. And if that's successful, additional support will be placed for that child or young person. So there are four broad areas of need, and in the SEND Code of Practice 2014, in Chapter 6, it outlines them as the following: communication and interaction, cognition and learning, social, emotional and mental health, and sensory and or physical. So Chapter 6, point 6.28 and 6.35 of the SEND Code of Practice explains that schools should not be not just providing support for children with learning needs, but they should be considering all of those. For example, if a child's got a sensory overload in certain situations, then schools should provide support regarding this, even if the child itself or themselves is excelling in their learning. And they're ticking all those boxes, but they've got a sensory overload and they find walking down the corridor or lunch times particularly stressful because it's a sensory overload, then schools should be putting support in place to meet those needs. Sorry, I'm just a bit confused with this next slide. Sorry about that. So the graduated approach. This is what's happening. This is what's sort of recommended in the SEND Code of Practice. 4.4 states that where a pupil is identified of having special educational needs, schools should take action to remove educational provision in place. The SEN support should take form of a 4-part cycle, which is the graduated approach. Each part of the cycle is detailed. So the first thing that children will need to have done by the class teacher and probably the school SENCO is an assessment. So they'll look at what the gaps are for that particular child and what needs to be done. So schools and early years settings, this should be done anyway as part of the national curriculum. But for children with additional needs, assessments may be done by other professionals to get a clearer picture of the particular child's needs. So it might mean that the educational psychologist maybe observes the child, or it might mean a speech and language therapist comes in, or an occupational therapist, and they will then feed their information of what they've seen in the assessment back to the school SENCO. From the assessment, plans should be put in place setting out targets for children based on these assessments, and support, which means an individual target for each area. They should focus on outcomes of any target and what its purpose is. So they might decide that that child needs, for instance, off the top of my head, 20 minutes of speech and language therapy 3 times a week to be delivered by a teaching assistant, and that might be done through a package that's already available in school. But this will need regularly assessing and observing, because there's no point in putting support in place if it's not going to be reviewed, because it might mean that the child or young person has made really big progress and big leaps in that, or it might mean that it like to tweak that and look at the target. So they'll carry out what they've planned and regularly respond to the reviews. So they recommend that this is reviewed every term. So they'll look at those targets, see how they're working. If they're working effectively, how can they be changed, pushed to push that child further, or if they need to be made a little bit more basic for that child to make progress. Parents should be involved in this process throughout. So usually when a child is receiving SEN support, they should be having a meeting at least once a term within school to discuss the additional targets that their child is having as part of their plan. So as I said before, universal support is quality first teaching. It's within the classroom and it's with schools' basic funding. SEN support is additional and different from the universal support. So it means that the child or the young person in question will receive the universal support and something additional to that. There's additional funding for children receiving the SEN support, and children receiving SEN support will be added to an SEN register within school. Parents should have regular meetings with the school SENCO or area SENCO for early years settings. SEN support, as I explained, is different from an additional to what is universally provided for all children. Children who require the additional support are required to be on the SEN register. The SEN register is something that settings use to keep a record of children who require this additional support. The SENCO is responsible for all children on the SEN register. When children are on the SEN registers, SENCO should meet regularly with parents at least 3 times a year, so as I explained before, termly. And they'll go through the graduated approach, as explained earlier. Children on the SEN support will be given individual targets set according to their needs, and the graduated approach should be used to see progress. Settings use things called individual learning plans to record these targets, but they have a variety of names in different settings. For example, children that I've worked with in the past have had individual education plans. Pupil passports, quite a common one now, that's used a lot in schools, but they're all basically the same. It gives a record of that child, what the targets are and how they're working towards those targets, so how sessions are being delivered and how the child is progressing to meet those targets. So a lot of what we get asked by parents is about SEN delegated funding. It's quite tricky. Different settings get their funding from different areas of the government, but hopefully this will clarify some of it for you. So it works differently depending on the type of setting. Schools' SEN delegated funding is additional to funding that schools get to support children who are on the SEN register and are receiving SEN support. Schools are expected by the local authority to provide the first £6,000 of support for each child on the SEN register. And this is based on that were on the year before. So all the children on the SEN register for the previous year. So the local authority will give those funds to the school based on the previous year's SEN register. Sorry, I'm just finding my notes here. Schools should record how much of their SEN delegated budget they are using on children. So if a parent, for instance, wants to look into requesting an education and healthcare plan, if they feel that their children's needs aren't being met within school and receiving the SEN support, they might want to look at an education and healthcare plan. As I explained before, it's for children sort of with more complex needs, but a lot of our parents do ring up to request information on these. So what we would always recommend is conversations with school. And if school can show that they have spent an explained amount of money on that pupil within that £6,000 delegated SEN budget, it's quite a good tool for parents to use to show that their child is sort of exceeding that point of the £6,000 and that they might need an additional top-up that would be required from an education healthcare plan. So schools should be recording all of the SEN budgets that they're spending on each individual child, and we call this a provision map usually. So it just sort of details what the costs are for the individual groups that child might be attending within schools. So it could be speech and language, it could be that they receive time throughout the day with a teaching assistant dedicated to a small group to deliver sensory input or sensory breaks or additional physical have a lot of energy. if they've got ADHD, for example. So it just means that schools look very closely at their staffing and the costing of groups, and then they'll put into the of how that's been sort of divided between the groups of support that they provide for SEN pupils. Early years, they're funded differently. So they receive 2 and 3 year old funding, which is universally available for all that are eligible. For children who receive SEN support, they can apply for additional money from the local authority. So they usually do this through an area SENCO. There's a disability access fund that can be applied for by setting when the child's parents are in receipt of DLA. It provides settings with additional £615. The inclusion fund is given when there are a number of children who require SEN support within the setting. The area SENCO assesses the setting's need for this funding. So it's well worth private organisations like private nurseries getting in touch with the area SENCO quite early on to sort of discuss the funds that are available, because they have to be applied for. Colleges have access to funding from the Education Funding Agency. So as I explained before, education and healthcare plans are for children and young people that have got sort of more severe and complex needs. Most children within school and further education settings will always have their needs met within the universal support and an additional top-up SEN support where required. But for some children, an education healthcare plan is essential. Them getting the support that they need. If their needs are very complex, then the provision that they require will need that bit more in-depth planning. So there's an expectation for settings to use their SEN delegated budget before an education healthcare plan is given. So remember me saying before that the £6,000 SEN delegated budget is provided for all children on the SEN register for the year before. So by tracking the children or the young people on the SEN register and providing that information on funding and how that's been sort of divided amongst the children in a provision map is really quite a useful tool for SENCOs and schools, but also for parents in this process of sort of showing the local authority that actually school have provided all of this support, but we're still not sure it's enough. Let's, can we request an assessment? So it's a statutory document, an EHCP. It identifies a child's needs and lists a provision to meet those needs. It considers health, social care and healthcare needs. And in some instances, an education and healthcare plan means that school is given an additional top-up funding by the local authority to meet the child or young person's need. However, schools are still expected to provide that first £6,000 of support using their SEN delegated budget. So it might mean that a child is looking at, maybe in the second term of school, that SEN delegated budget of £6,000 is sort of coming towards an end for that pupil. So it might mean then that school, the SENCO, approach the parent themselves and say, we're thinking now that we need to look into an education healthcare plan. Parents can apply for them themselves as kind of young person in their own right. You don't need a school or a SENCO to do that for you, although the information that you get from the school or the SENCO is really very useful in the application. So it might mean that you have, if you're looking or you're wondering about an education healthcare plan, it might mean that you book a meeting with the school SENCO and the class teacher to discuss the sort of level of support that the child or the young person is receiving, and whether they feel that is enough, what their views are, if there's any additional support that they can put in place using the SEN delegated budget, or if that, like I said, if that's nearing the end, whether they agree that they do need an education healthcare plan assessment. So that really is sort of coming to the end. We do some training on education and healthcare plans Following that, we advise parents on the legal processes of that. So an education and healthcare plan is a legal document, and the statutory process for them is legally binding as well. So the threshold for assessment is relatively low in law. If a child is thought to have special educational need that may require provision through an education and healthcare plan, the local authority have a duty to assess that child or young person. Following the assessment, the local authority will then decide whether they feel an education and healthcare plan is essential for that child, to provide the provision that they will need to progress. And like I said, using those 4 areas, the broad areas before, it doesn't have to just be on academic studies. So if a child's doing really well in literacy and numeracy, parents often think that schools don't have to provide any support to meet the sort of social, emotional or mental health of children and young people. So with the fallout of coronavirus at the moment, we're getting a lot of children struggling with their mental health. Anxiety seems to have skyrocketed, and we're getting a lot of children now that are having school refusal. They are struggling to attend, they're struggling to focus, they're physically sick because they're so anxious about attending. So some of these children, their needs were being met before lockdown. Some of those children's needs have changed significantly because of the world that we're now living in. So we're having, I've seen, particularly myself as a practitioner, more pupils and more parents requesting education and healthcare plans based on social and emotional aspects of the child or the young person. So it might mean that they were receiving a little bit of SEN support before, they were receiving bits of support within school or college, but now they're looking at obviously exceeding that SEN delegated budget of £6,000. So they're thinking now that they need the additional top up from the local authority, and some of the provision that can be provided by the local authority, if it's set out in the education healthcare plan, it's legally binding. So that child or that young person should receive everything that's written in that plan. It's lawful. So it's a good way of parents ensuring that provision is provided long term. So yeah, it's a tricky one at the moment. We're seeing a big demand in information on support in school, and there's been, from what I can see, an influx in education and healthcare plan assessment requests. So there's a number of ways you can contact the service. We cover SENDiass service for Rochdale and Bury. So we sit under the umbrella of Barnardo's, but like I said, we're commissioned by the local authority, but we are impartial. We don't work with them. We work as a separate umbrella. So the contact details are there for, if you want to email us, practitioner will return emails and calls within 48 working hours. We do have a call log system. So if you email or phone, we record the time that we've received the email or the telephone call. We'll take basic details, and the practitioner will return the call or the email within 48 working hours. Our telephone number is the same for both, so you can get us on 01706 769 634. And for Rochdale SENDiass, you can email rochdale.sendiass@barnardos.org.uk. And for Bury, you can get us at bury.sendiass@barnardos.org.uk. We do sort of deliver other services under the Barnardo's umbrella. So obviously SENDiass, we do deliver short breaks activities for children and young people, and we deliver Shine and Shine Plus as well. So if you want any information on them, just ring the number that I gave before. We can either email that out or discuss it over the phone. Thank you.